This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google IvyPanda Free Essays.
Every doctor and nurse must have the skills and knowledge to communicate with people. Professionals not only create a treatment plan but also observe ethical principles. Ethics helps specialists act humanely, tactfully, and professionally, which positively affects the patient's recovery. The fundamental principles of ethics that laid down the activities basis for medical personnel are non-maleficence, beneficence, justice, and autonomy. This paper reflects the principle of non-maleficence, which assumes doing no harm. Despite the importance and apparent universality of ethical principles, there are many controversial aspects in their application. Medical workers have been a respected profession since ancient times, and some requirements have also arisen a long time ago. The principle of non-maleficence is reflected in the Hippocratic Oath words, "First do no harm." According to Varkey, this principle supports moral rules such as not to kill, not to cause pain and suffering, not to inflict offense, and similar obligations. For me, this principle is the basis of practice and an action guide. Decision-making based on the assessment of potential consequences, benefits, or harms is critical. Moreover, the violation of non-maleficence, in addition to the damage to health itself, can destroy the patient's trust in medicine. As a result, if there are many such people, it threatens the reliability of healthcare and the nation's health. In practice, the principle of non-maleficence must determine every action of a medical professional. It implies assessing the benefits and burden of potential treatment steps and choosing the best one for the patient. This assessment is critical in complex bioethical dilemmas such as abortion, euthanasia, and similar issues. The problem is that in terms of different approaches, harm can imply various things. I most often apply this principle by offering the best treatment options, preserving patients' confidential information, and respectfully communicating with them, considering their emotional condition. Violation of these rules can harm a person's health and dignity. Despite all the aspirations of specialists to comply with ethical principles, their workload and sometimes character can lead to a violation of non-maleficence. I witnessed an example that included harm due to neglect. A patient confined to the bed could not move enough, and due to workload and fatigue, the staff did not pay enough attention to this problem. As a result, bed sores appeared that caused significant inconvenience and healed for a long time. The incident drew attention to the problem, and the administration took measures to eliminate it. The established work structure significantly influences adherence to ethical principles in the hospital. For this reason, the critical responsibility of the health manager is to promote an ethical culture. To do this, one must set high standards displayed in the rules and give resources for their promotion. Moreover, providing resources for high-quality service delivery is part of promoting ethical practices. Staff care will also ensure a more optimal and professional approach to patients. Thus, the compliance of medical personnel with ethical principles is vital for the high quality of services. The non-maleficence principle means not causing harm and contributes to caring for patients and establishing trust in hospital staff. It implies the choice of the best treatment option for a patient exceeding the burden. However, the use of non-maleficence is not always easy due to differing views on harm. Health managers need to ensure an appropriate work culture for staff commitment to ethics. If you want to find more works like this essay on non-maleficence as an ethical principle in healthcare, head over to ivypanda.com. It has a collection of free samples with thousands of submissions covering virtually all academic subjects. No registration required to access it.